We're here with Dr. John West with Breastlink. Thanks for being here, Dr. West.
Thank you for having me. It's a pleasure.
Well, you know, women out there are really concerned about breast cancer and worried, you know, what can they do to lower their risk? So let's start out with self-breast exams. If a woman doesn't do a breast exam, will they still find out if they have a soreness or that kind of thing? Will they still find out if something is wrong if they don't do that exam?
Well, there's a great deal of controversy about breast self-examination, as you know, but for women under 40, that's really the only screening thing that's available to them. And there's been a lot of confusing information. I found in my 40 years of practice that if you take the time to teach a woman to do self-exam with confidence, and she does it regularly, she's better at picking up a subtle change than the physician. So what we really need is to get women to buy into this concept of self-exam, learn to do it properly, watch the video that we've made and we have told you about, and take that to heart and do the exam. And if there's a change, bring that to the attention of the doctor. Now, this is true for all women, not just the young women, but most women at 40 will start getting their mammograms. Mammograms are the most effective screening tool for picking up early breast cancer. So we strongly urge women to do that. But the self-exam is an additive protective factor. It's a layer of protection to do breast self-exam regularly. So we know that the mammogram misses some cancers. We know that some cancers show up between mammograms. And so we want to give the woman full protection, and we want to give her the maximum protection to catch cancer early. When we catch cancers early, we save lives. When there's a delay, as there often is when women don't follow these guidelines, then cancers typically are diagnosed later in their evolution and they're not as curable. So that means you go through all the treatments and a higher percentage of them are going to come back, and some of those women aren't going to make it. And so the more effort we put on early detection, the more lives we'll save.
Well, what I appreciate you've said as well about the self-exams is initially, you're not looking for something. You're just thinking that everything is normal, and you're just trying to get to know your breast area and to know what, like the different structures and that kind of thing. Is that something women worry about the most, of like, oh, I need to find something every time I do the exam?
Well, when women just try to do self-exam, they get very nervous. The breast is quite lumpy. They feel all the lumps, and they first think, well, could all these lumps be cancer? And then they say, well, which lump do I worry about? And as time goes on, they finally say, you know what, this is just too anxiety-provoking. I'm not going to do it. And this is what I get for most of my patients, or I did early on in my experience. What I learned is when I do the exam is to talk to the woman about the importance of self-exam and the importance of understanding the word normal. When I get done with a careful breast exam, or a physician does, the patient can be assured that her breast is normal. That's the time to go home and learn about what the normal breast feels like. It takes several nights and a lot of time and a lot of concentration to get clear in your mind what the normal breast is. But once you know that and you do it regularly, you're better than the doctor at detecting a change. If the woman does detect a change, she needs to find a doctor that'll pay attention to it. Many times the doctors just say, oh, honey, don't worry about it. You're too young. It's just fibrocystic. But many times those are actual cancers. And there's ways we can go about finding out whether they're benign or malignant. So with a mammogram, the extra views, the ultrasound, if everything comes back okay, then we just see the woman in a few months in follow-up. But I've found if you're that careful about teaching self-exam, inspiring the women to follow early detection guidelines, have them come back to you, you're going to save lives. So you think of breast self-exam as a layer of protection, and any woman, once she has breasts, can learn to do it and learn to do it well.
Okay, well, that's inspiring. Now let's talk about just things like eating and exercising. I'm a big red meat eater. But if I'm eating red meat, but I'm still eating fruits and vegetables and exercising, is that still a risk factor?
Well, diet is proven to be consistently proven to be an issue in terms of breast cancer risk. And one of the things that's coming out, I think, most recently is that the raw meat, the meat isn't so much of an issue. It's the carbohydrates in our diet. The American diet is primarily based on carbohydrates. So that's potatoes, rice, bread, pasta. That's basically like eating sugar. And when you eat either sugar or these carbohydrates, it all turns to sugar in your digestive system, and your blood levels of glucose go sky high, and then your insulin shoots out, and the insulin brings it down, then you get hungry again and you want to eat. So that leads to weight gain. But more importantly, it leads to prolonged heightened insulin levels, and we know that that's a risk factor for developing breast cancer. So diet is important. Keeping your weight controlled is extremely important. We know that reduces the risk. And then exercise. these three are probably the mainstay of reducing a woman's risk of breast cancer. So it's keeping the weight down, eating the right foods, and exercising regularly, and then keeping the alcohol.
Well, that's what I was going to say, to drink or not to drink.
I know a lot of people getting nervous right now.
Well, there was just some recent information linking, breast cancer with alcohol, and it makes you wonder because, on one hand, they tell you having a little bit is healthy for you, and then now the studies are saying no, as far as with breast cancer.
Well, what they're saying, first of all, this came out about 20 years ago, and I was a big skeptic. It just didn't seem to make sense to me, but these things don't always make sense. But the more studies they've done, the more they've shown that more than 3 ounces of alcohol a week is associated with a small increased risk of breast cancer. But think about it. Sometimes these articles are very confusing. If your risk over the next 5 years of getting breast cancer is 1 in 1,000, and you double your risk, you've only increased it by 1 in 1,000. So you have to be real careful about reading these things. And I think that there should be a balance. Excess alcohol, 10, 15 ounces a week, I think has a lot of bad side effects. But having 3 or 4 drinks a week, or 5 or 6, I really don't think it's that big a deal. I mean, as you say, there's beneficial. Even the writers of these articles say that the big picture is not that clear right now. The benefits may outweigh the risk. So it's something to be aware of. But I think rather than focus so much on alcohol, I keep it to a relative minimum, but exercise, weight control, eating the right things, high fiber, low fat diet is protective, and it should be done.
Okay. Well, that sounds great. I think those are things that all women can follow. For more information on Dr. John West, you can visit Breastlink.com.